Enugu State is plagued with the problem of scarcity of water, which is as a result of the geographical formation of the soil. This problem has had and is still having adverse effects in communities like here in Amufie community, Enugu Ezike of Igbo North local government area. Here in Amufie Primary Health Care Center, they face several challenges ranging from the lack of access to water, lack of access to decent sanitation infrastructure and power supply. One of the major challenges they face in Amufie Primary Health Care Center is the challenge of lack of access to potable water. Here in Amufie Primary Health Care Center, they have an in- and outpatient number of over 120 people who come here to access healthcare services ranging from antenatal, postnatal, immunization, childbirth, and so on. And these practices cannot go on smoothly without access to water. Hence, the need for available water supply here in Amufie Primary Health Care Center.
We don't have toilets, we don't have a borehole, we don't have many other things, but the most important one is water. Because as we are running many things in our health center, like antenatal, like delivery, immunization, family planning, we need water most. We can even use it to wash our equipment, even when child delivery, after delivery. We can even use the water to wash the baby and the mother. Because one woman that delivered last time, because there's no water, the husband run around from this Amufie Health Center to Ekpo borehole, and it took us almost 30 minutes before he come back.
The challenges that I met the day I delivered my child is water, because there is no water in the hospital to bath my baby and me. So my husband went to a neighboring village, which took him almost 1 hour before he came back.
He give my husband gallon to go and fetch water before I deliver my child, and no water in this village. So he give her can to go and fetch water in Ogbute. When he go to Ogbute, no water there, and he go to Uroshi to go and fetch water. Before he came back, I have already delivered my child.
I'm here for antenatal. I'm not going to deliver in Amufie Health Center. I want to deliver in Ogbute because I don't want to face the challenges of water here. Before any woman gave birth, she has to run helter-skelter to go and fresh water. You will suffer and suffer before you get water. Even when you deliver, there is no water to bath your baby or bath you.
South Saharan, as a community-based organization that believes in water, sanitation and hygiene as one of its thematic areas, is striving to ensure that there is provision of water in communities like this, and also ensure that there is decent sanitation facilities in communities like Amufie community. We intend to build a solar-powered borehole here in Amufie Primary Health Care Center that will be reticulated inside the Primary Health Care Center and also outside the facility to enable other members of the community benefit from this project, and also renovate the toilet facilities in the Primary Health Care Center, which will in turn reduce the maternal and child mortality and morbidity rates in the community.